May is Stroke Awareness Month, and it's really important to know the signs of a stroke. It can be really dangerous, but it's also preventable. I am joined by Dr. Singla from MUSC. Thank you so much for being here.
Thank you for having me over here.
Yeah, so tell me a little bit about your background and what you do over at MUSC.
Of course. So my background is in pediatric neurology and neurology as well as in stroke to begin with. And I joined MUSC about 2 years ago. And we started as a neurology service line to kind of see the patients with headache, migraine, seizures, as well as the stroke. But over the last 1.5 years to 2 years of my job, we realized that we were seeing most of our patients where stroke burden was higher, which we kind of know from our data. So we worked on establishing our Columbia Downtown Center as a primary stroke center. So fortunately, we were lucky and we got all the papers checked in, and 2 weeks ago, we got our certification. So now we are our primary stroke center as well.
That's wonderful. Well, congrats.
That's good news. We take care of patients with stroke.
Yeah, and we were talking before cameras started rolling. The Columbia area specifically is actually kind of a hotspot for strokes.
Correct.
Tell me why that is.
So that's based on data that has been driven from uncontrolled hypertension, diabetes for the patients, those who lived 30 years, 40 years ago, been diagnosed and had developed bad habits of not eating healthy, smoking, not taking care of their blood pressure, not checking up with their doctor regularly. Then those are the ones, long-standing hypertension, diabetes, causes them to have stroke or increases the risk of having a stroke.
Wow, really interesting and very important to know.
Correct.
So for those of us who haven't experienced strokes or really aren't familiar with strokes and the signs, tell me what a stroke is. What's happening to the brain when you're experiencing a stroke?
So during a stroke, the main thing that is happening is that you have lack of supply of oxygen to certain part of the brain. And when you have lack of supply to certain part of the brain, you're going to have some focal deficits, what we call it. Means you're going to have numbness or weakness to certain part of your body. And that's what exactly a stroke is.
Okay. What are some of those signs? You know, I know it's weakness in parts of the body. Go a little bit deeper into that.
Surely.
What are those things we should be looking for?
Numbness on one side of the body means numbness on the right side of the face, left side of the face. Weakness on the right side of the face. The face becomes droopy on right to the left side. Same thing with the arm and the legs as well. You can have numbness or just tingling sensation out of the blue. You can have weakness. That means somebody's keeping the arms up and all of a sudden the right side is weak.
Okay.
The newer symptoms that are also happening is that somebody can just have dizziness or vision loss or difficulty in talking or speaking,
getting
or
off
even
balance.
Getting off balance,
right?
Even speaking or understanding. Many times, the reason that stroke still remains a little challenging situation to diagnose, or patients don't come on time to the hospital, is because they can have difficulty in talking, and they cannot express themselves that I'm having a stroke or I'm having difficulty in getting my words out correctly. So.
Wow. Well, what's one good side to this is that strokes are preventable.
Correct.
What are some things that we can be doing in our daily lives to just help prevent the possibility of having a stroke?
Eating healthy.
Okay.
Taking care of your blood pressure, checking up with your primary care doctor if you have blood pressures, or specifically if you've had a stroke before or a coronary artery disease like a heart attack before, making sure that your blood pressure, your cholesterol levels, and if you smoke, you drink, you kind of want to quit those things as well.
Yeah, just taking good care of yourself is really what it boils down to. So the FAST method has been talked about a lot in stroke, stroke prevention and for someone experiencing a stroke, but the FAST method has evolved.
Correct.
So tell me what the update is.
So the update is the BFAST method.
BFAST method.
So now we added balance and eye problem as well. Means somebody who's having balance issues, that just boom, it's there.
Okay.
Somebody's having vision changes all of a sudden, you see double. And then you look into the eyes, one of the eyeball is not in the center, or they have difficulty, they're seeing double, or they have vision loss. They cannot see anything on one side. So that could be signs of stroke as well.
And then what does the FAST stand for?
So F is your face. So your face is droopy, left or right side. And A is for your arms. Your arms are not 100%, or your legs. S is for speech. They're having slurred speech, which we call a fancy term as dysarthria. Or they're having difficulty in language or understanding. And T is time. Brain is time. So every single second counts for that patient. So if you see, or one of your patients is having, one of your friends or colleagues or coworkers or somebody even on the street, you see and you're like, something is wrong, and maybe a stroke, time is money. So you want to notice what time did you notice that patient having those symptoms and calling 911, because The reason behind why time is so important is because, as you say, if somebody is having a stroke, we have a clot buster medication that can be given within 4.5 hours of the symptom onset.
Okay.
So that's why it's important to know when was the last time the patient was normal.
Okay.
If the patient is within window and the patient is having an ischemic stroke, means lack of blood supply to certain parts of brain, we can give that clot buster medication, and that can open up those channels or vessels, and the patient can do better then.
Wow, that's amazing. That's really incredible. So if we suspect, I suspect someone in front of me, whether it be a friend or family member, or even just someone in the community, is experiencing sort of those symptoms, what are the next steps? What do I do as a bystander, as a friend?
I think the best thing would be to first look at the watch if you have a clock, and make sure that the patient is in a safe location. The patient is not going to fall if the patient is on a stage or a height.
Yeah.
And the third thing will be to call 911.
Okay, wow, that is really incredible. Thank you for teaching us all of this. Really important, especially during this month, to learn about awareness and prevention. Are you guys currently accepting new patients?
We are. We are 3 neurologists at MUSC. All of us are seeing patients in the clinic. So if somebody needs any neurological care or specifically had a history of stroke or is having a stroke, give us a call.
Come on by. Awesome. Well, thank you so much for being here, Doctor. And we're going to have all of this information up on our website, Soda City Living, and also their contact will be up on your screens.